Hello, Walter's family. I am Aspen Mrak, your genetic counselor, and I'm here to help your son Alton, who has been showing some signs of the rare disorder Fragile X syndrome. First, let's just get into what Fragile X syndrome is. So, it's a genetic inherited disorder that affects the X chromosome. The X chromosome creates a gene called fMRI, and this gene makes a protein that is vital for brain development. So, in Fragile X syndrome, this gene is mutated, leaving those with the disorder a learning disability, since their brains are unable to fully develop. If Alton does test positive for this disorder, he will likely experience moderate learning disabilities and moderate irregular bodily structures. Primarily, this disorder deals with underdevelopment of the brain. Okay, here's the karyotype for Fragile X syndrome. I'm going to move this so you can see the X chromosome. I think you can do that. Okay, yeah, you can. That's so cool. Okay, anyway, so what's a karyotype? A karyotype is a visual collection of a person's chromosomes. As you can see, on the second, the one on the bottom row, second to the right, that is the X chromosome. Obviously, it is not supposed to look like that. This is a karyotype of a patient with Fragile X syndrome. As you can see, the X chromosome is not shaped normally. If you look at the one on the top, the one on the left is a normal X chromosome, and then the one on the right is Fragile X chromosome. This happens because typically DNA stretches evenly along the chromosome, but with this disorder, the DNA is going to stretch beyond a certain length, which switches off the portion of any function for that part of the chromosome. So as the karyotype shows, chromosome is damaged, causing a fragile site that is unable to function properly and produce and send out the necessary proteins as it is supposed to. The functional damage present in the chromosome is also represented in physical damage, as you can see. This fragile site is going to leave it just unable to send out these proteins as it's supposed to. They're going to be sent out in abnormal amounts, if sent out at all. So I just wanted to show you what it looks like on the outside. Question time. Okay, so first question, what will happen to Alton with this disorder? Are there stages? So in most cases, life with Fragile X syndrome is relatively normal. He'll be more prone to general health issues, such as seizures, delayed speech, learning, and intellectual disabilities. Patients with Fragile X syndrome also have behavioral issues, as their brain is incapable of expressing emotions normally due to the fact that their brains are having difficulties developing properly. They will have aggression, hyperactivity, acting on impulse, nonsense word repetition. There are a lot more, but those are just the most common ones. If you notice Alton having any behavioral issues whatsoever, you should definitely note them and just be patient with him and try to help him out, because it's a huge indicator of Fragile X syndrome. So on the part with the stages, biologically, there's no progression or stages with this disorder. For most individuals, rather than having specific stages, it changes due to specific personal differences. So this progression, per se, varies in each individual. Fragile X syndrome affects each person differently at different points in a person's life. Behavioral symptoms, for example, they can get better, they can get worse. They can stay the same throughout a person's life. It just really depends on that person specifically. But certain complications can develop later on. It just, again, depends on the person. So while this disorder does not particularly cause extreme complications, it will cause mild complications. So the developmental proteins, these are the fMRI. They produce these. So they are present in many tissues all over the body, but they're predominantly in the brain and the testes. So since it's not a dominant protein in general bodily tissue, it's just going to cause mild complications such as bodily tremors and movement abnormalities. But many people who don't even have Fragile X syndrome experience these symptoms. So they're pretty normal and they won't set them apart at all. But with abnormal fMRI production in the testes, these testes will be enlarged and they'll occasionally cause feelings of nausea when they become swollen, but there's usually just medication that can ease the swelling and ease the pain. So it's pretty easy to manage. The fMRI in all of the tissue, including the brain and the testes, they will only cause a lot of problems if something else is happening in the body to interact with this fMRI production and cause problems. So it's not going to cause problems that often. It's just really the learning disabilities that's really the only severe problem with this, if severe. There's a low chance that it's going to be a severe problem, but it could, which is why it's important that you learn how to help Alton. And finally, in my opinion, the most important question, how can you support him? So since there's no known cure to this disorder, you need to check up on him constantly, making sure that he's not in pain, making sure that he's happy. And there's a lot of therapy, like behavioral therapy, that can really help him understand his emotions and learn how to control them and just learn how to process things. Intellectual activities such as coloring and puzzles, they're also very helpful to helping him develop his brain even further. Most importantly, use simple, calming language that he will understand. especially read his body language, because he won't be able to express how he really feels with words because he's going to have trouble with that. But his body language will just show everything. So really pay attention to his body language. It'll express how he really feels. But most importantly, just remain patient with him because it'll be a long journey. But with proper care, he can live a normal, happy, healthy life. So where to start? First up, testing. Testing can prove that Alton does indeed have Fragile X syndrome, and it'll allow him to receive treatment specific to his needs, enhancing his daily life. There are multiple genetic tests that can be done to diagnose this syndrome. They're right there. I'm not going to get into them because it would take a really long time, but it is in the case report if you would like to read it. So he can receive treatment dedicated, if he does the testing, of course, and he tests positive, he can receive treatment dedicated to reducing the symptoms, since there's no treatment that can just get rid of the disease, or not disease, disorder as a whole. So, but it can reduce the symptoms. So for Fragile X syndrome, there is therapy, assisted education, and medication to help Alton. Can't prescribe any of these options without a proper diagnosis, but after testing is complete, this can be determined for him. The tests show specifically where in the body is worse than other portions. It provides specific information about what needs most assistance. So educational therapists can describe information in a way that matches Alton's cognitive abilities. It truly does help him understand things in a way that makes sense to him. For medication, say the testes is swelling, medication can be prescribed to ease the pain, ease the swelling. Behavioral issues, if that's the main problem, therapy can help him cope with what he feels. There are just many options to help reduce the symptoms of Fragile X syndrome, which in turn enhances quality of life and allow him to live normally. This disorder should not be much of a problem if he follows through with extra behavioral and education assistance all throughout his developmental phases, all throughout his developmental phases until he's 18, possibly older, just depending on his progress. But really, the first step is testing. Once he gets tested, we can find him a treatment, and this treatment will last his entire life, and he can live happy and healthy. I hope that this helped. If you have any other questions, please feel free to contact me. But I hope that this helped clear some things up about the disorder, and I wish your family and Alton the best.